I have skin sagging around the corners of my mouth and chin that makes me look old. What procedure is best to remove this? I have sagging skin around the corners of my mouth and it makes me look old. What would be my best procedure to remove the sagging around my chin?
Thank you for your question. You've submitted a single photo, which is a little bit blurry, but nonetheless, I think well representative of your situation. And you've asked, you have sagging skin around the corners of the mouth and the chin, and what would be the best procedure for you to treat this? Well, understanding that in your situation, this represents an aspect of facial aging, which is basically the descent or weakening of the support structure of both the skin and the underlying tissue under the skin called the SMAS. The SMAS stands for the superficial musculoaponeurotic system. And when people come to our practice with this concern, they always do something which we call the mirror lift, where they physically, vertically lift everything upward and say, "Look, doc, doesn't this look good?" And I agree, it does look good. This is an opportunity for you to learn about what is typical in our practice and how we decide what type of procedure to do. So when you're doing your research, you will see terms such as facelift, face and neck lift, and then you'll also come across all kinds of proprietary names that have been given to various quick recovery procedures or procedures that claim to be remarkable discoveries that are only done by a particular company. So it can certainly get very confusing. In 20 years of practicing cosmetic surgery, specializing in facial aging effects on the eyes and face, I can tell you that a lot of fads have come and gone, and that definitively the best thing to do is to do the surgery that gives you the best result, that will be long-term and is done properly. So the pendulum swung back and forth a lot over the past 10 or 15 years, and there was a point where people were really excited about short scar limited incision facelifts, and unfortunately for people who have more volume shifting in their face, they can get an improvement, but they don't necessarily get everything that they want. So consultation is very, very important, and the idea is to make sure that you have very good communication with the surgeon you choose. Now, a lot of times people are afraid of having a procedure like a facelift or a face and neck lift because they've either seen pictures in magazines, read horror stories on the web, or they know someone who had a procedure and that person went through a very rocky healing process. Just to give you an idea of how we approach this, in our practice we developed over the 20 years a quick recovery concept, but not doing shortcut procedures. So what I did was I decided to do the procedures that were typically done under general anesthesia, but perform them under local anesthesia with minimal sedation. And by developing this technique, we were able to basically get the full benefit of a more proper procedure and still reduce the risk as well as the recovery related to anesthesia and prolonged surgery. So at this point, it is probably best for you to start meeting with surgeons and learn about each individual surgeon's particular style of how they do their procedure. When I first moved to the Upper East Side in New York City, I was very shocked to see how many people looked very pulled and over-tightened. And over time I learned that essentially it was the aesthetic style of both the patient and the surgeon that this particular look was considered desirable. I always feel like every patient's face has unique character, and it is my role as their surgeon to maintain that character and to restore the key elements of their appearance that make them look more youthful, such as elevating the cheek, improving the jawline, defining the neck. So I actually wrote a book a few years ago called The Fine Art of Looking Younger, and I think that helps you understand that there are different surgeons with different styles. My particular style is more of a natural look. Other people are of a more exaggerated look. And it is a matter of the person's individual taste and their comfort level. I can't stress enough the importance of communication. So when you meet with doctors, make sure you're given the appropriate amount of time so you feel comfortable and understand what you are committing to. So with that being said, I wish you the best of luck. I hope that was helpful, and thank you for your question.